Hey everybody, so today I'm going to walk you through the concept of diaphragmatic breathing, which is a style of breathing that you are probably going to want to mostly utilize during your exercising and your lifts while pregnant, as opposed to other forms that may be more about holding your breath and bracing heavily in your midsection. You may be used to doing this with like really heavy lifts. And the reason we want to avoid that in pregnancy is because it can place a lot of pressure on your abdominal muscles and also your pelvic floor. And if you're pregnant, you've got enough pressure on your pelvic floor already. So we want to instead think about breathing throughout the duration of a movement and maintaining stability and tension in your core without undue, unnecessary pressure that could cause some problems or some discomfort. So I'm going to walk you through what that breathing feels like. You may want to practice doing this just kind of standing, sitting, until you get a little bit more comfortable, and then you can practice with some body weight movements, and then eventually under load if you're doing some weighted exercises, because it can feel a little bit weird at first. It can be hard to connect to our core when we, have a big belly, but your core is still there, your muscles are still there. So, and the more we work on it this way during pregnancy, I think in a lot of cases, the easier time we'll have reconnecting and kind of building back our core strength postpartum. So what you want to do with diaphragmatic breathing is you want to think about doing an inhale through your nose and sending the air into your rib cage and your stomach. So not a kind of breath up here into your lungs, but sending the air down here. And you'll notice, because you'll be able to feel and see your rib cage and your belly expanding as you do this. And then when you exhale in a kind of controlled way through your mouth, you want to think about bringing your core muscles together and sort of hugging your belly, hugging your baby in towards your spine. So this isn't like a try to flex your abs kind of thing, which we can't really do anyway. It's really kind of thinking about those deep core muscles, bringing them together to create a little bit of support in your midsection. So I'll show you what this looks like from the side so you can see. And it's a little bit overly done here in the video, but you'll get a sense. Okay, so okay, so you get a sense of what's happening there, and I can feel a nice kind of comfortable connection to my core on that exhale. That's going to help me when I'm lifting or moving. I'll show you, I'll do a couple kind of just body weight squats here into a chair so you can see. The idea is sort of continuous breathing. You're making sure you're getting the air that you need and also creating a healthy amount of tension. Okay. Make sure the chair is behind me. Okay, so diaphragmatic breathing, breathing continuously, creating core tension and connection without too much pressure.